Pratik, are you there?
Yes, ma'am. Yes, ma'am.
Yeah, please start it.
Yes, ma'am. Session is started. It's already nice.
गुड इवनिंग, नमस्ते, खुशामदीद, आप सबको मेरा नमस्कार। आज हम सब बहुत दिन के बाद मिले हैं और जैसे आप जानते हैं हर वेडनेसडे को हम मिलते हैं। एवरी वेडनेसडे वी मीट हियर टू डिस्कस समथिंग अबाउट आवर डिजीजेस एंड द प्रोसेसेस व्हिच इन्वॉल्व आवर ऑर्गन सिस्टम्स। आज मैं आपके सामने एक बहुत ही महत्वपूर्ण टॉपिक लेकर आई हूँ और हमारे गेस्ट भी स्पेशल है। लेकिन उससे पहले जो है ये जो एपिसोड है हमारा 688th एपिसोड है डॉक्टर के मेड टॉक्स का। और हम सबको जो है किस्मत है हम लोग कि डॉक्टर के अग्रवाल जो है उन्होंने ये जो एक लिंक हमें दिया है हर वेंसडे को और हर रोज जुड़ने का और एक दूसरे से मिलने का। ये बहुत ही एक अच्छा लिंक है। तो आज हम बात करेंगे एक बहुत महत्वपूर्ण टॉपिक के बारे में। उससे पहले हम चलते हैं हेडलाइंस ऑफ द डे पे। मैं आशा करती हूँ कि आप सब जो है मुझे सुन पा रहे हैं क्योंकि बीच में जब हम प्ले करते हैं तो मुझे कोई भी ग्राफिक्स या कुछ भी सुनाई नहीं दे रहा है। मुझे लग रहा है कि कुछ टेक्निकल डिफिकल्टीज आ रही हैं आज। पर आज की हेडलाइंस पे हम चलते हैं और हेडलाइंस जैसे हमने पहले भी देखा है वो मोस्टली जो होती हैं कोविड-19 के बारे में होती हैं। और आज का हमारा पहला हेडलाइन यही है कि हमारे एक्टिव कोविड-19 के केसेस जो है वो 99,602 है। हमारे यहाँ जो इंडिया में केसेस है वो 14,000 थे पिछले 24 घंटे में और जो डेथ्स रिपोर्ट हुई थी वो 30 डेथ्स रिपोर्ट हुई थी। हमने ये ज़रूर देखा है कि लोग मास्क पहनना भूल रहे हैं, क्राउडेड प्लेसेस में भी मास्क नहीं पहन रहे हैं, जो कि बहुत ही गलत चीज़ है। Because we have seen that COVID appropriate behavior is absolutely essential to get the numbers of COVID 19 down. And we are all aware that there are new variants coming up of COVID 19, which may not be causing mayhem like the previous ones. But we have to be aware that even if we are vaccinated, we can get infected with the newer variants. If you have not taken your vaccination, please go grab it. The scientists have deciphered that genetic network and biological mechanisms are associated with COVID-19 myocarditis. Now, myocarditis is something which can also cause heart failure. We will talk about it more with our very senior guest who is going to throw some more light on this topic. A non invasive method of testing saliva sample might detect type 2 diabetes earlier than the serum test, which is a welcome change because it will become easier to diagnose diabetes. Restricted emergency used to India's first indigenous mRNA COVID 19 vaccine for 18 years and Covovax for 7 to 11 years has been granted. And Hong Kong has reported more than 2,000 COVID 19 infections on Wednesday. This has been the highest since April, ahead of celebrations to mark the city's 25th anniversary of its handover to China. चाइना में हमने ज़रूर देखा है कि पहले भी जो नंबर ऑफ केसेस होते हैं, वो कई बार हाई होते हैं, कई बार लो होते हैं, लेकिन वहाँ के फिगर्स ज़रूर हमें डाउटफुल लगते हैं बीच में क्योंकि वो अपने फिगर शायद कई बार हमसे या साझा नहीं करते या बताते नहीं हैं वर्ल्ड मीडिया को। नाउ लेट्स गो टू द टॉपिक ऑफ द डे। हमारा आज का टॉपिक है हार्ट फेलियर डायग्नोसिस एंड मैनेजमेंट इन इंडिया। हार्ट फेलियर एक बहुत ही महत्वपूर्ण टॉपिक है और हमने देखा है रिसेंटली जो है हार्ट पे काफ़ी स्ट्रेस आया है क्योंकि कई सारे यंग ऐसे लोग हैं जिनकी अचानक जो है मृत्यु हो रही है। इनका कारण जो है हम डिस्कस करेंगे आगे। हार्ट फेलियर क्या होता है, उसे कैसे जाना जाता है, उसकी क्या इन्वेस्टिगेशंस होती है, कैसे इस चीज़ से बचा जा सकता है या रिस्क फैक्टर्स क्या होते हैं, ये सब कुछ हम अपने गेस्ट से डिस्कस करते हैं। मैं इंट्रोड्यूस करना चाहूँगी अपने गेस्ट को आज। लेट मी इंट्रोड्यूस यू ऑल टू माय गेस्ट टुडे। ही इज़ अ वेरी सीनियर डॉक्टर। ही इज़ डॉक्टर Jayagopal P. Balagopalan. Good evening, sir.
Good evening. Hi, Dr. Vinay. Hi. Good evening,
A
everyone.
very warm welcome to you, sir, on this show. We are indebted to you that you have spared some time out of your busy schedule and you are here to discuss with us the heart failure, its causes, management, and everything related to heart failure. डॉक्टर जयगोपाल के बारे में बता दूं, he is the director and head of department and senior interventional cardiologist at Lakshmi Hospital in Palakkad in Kerala. With around 30 years of working experience in the field of cardiology, he has performed over 20,000 invasive procedures, including 7,000 coronary angioplasties. He is the member of GHATI working group on ST elevation MI and member of APSC panel on heart failure in Asia Pacific. He is the president of Interventional Cardiology Council of Kerala and president-elect of National Indian College of Cardiology. He is associate editor of esteemed Indian Heart Journal and has about 40 publications in peer-reviewed journals and contributed many chapters in updated books. So here he is with us, gracing us with his presence. Thank you, sir.
My pleasure to be part of your show. I think hope the audience will benefit with some interaction and discussion from both of us this evening.
Right, sir. So recently, we have seen people have actually become more, they have become more inclined towards knowing whether their heart is functioning optimally, or they have some kind of problem with their heart. Maybe somehow this was brought in due to COVID-19 because we have seen that COVID-19 is a multi-system disorder which can involve your heart and lead to acute problems in the heart. And on top of it, we have also seen certain celebrities and very popular people getting affected heart wise. So, in all, this is a good thing that people are getting more aware of their condition and they are very keen to know about heart failure. So, अगर हम heart failure के बारे में बात करें कि heart failure होता क्या है? What is heart failure actually?
Yeah, I think I may have to speak in English, and maybe for the sake of the audience, a little bit of translation from your side would be required. So I think it's basically the heart function, as everyone knows, is to pump blood to the various vital organs, whether it's a brain, the kidney, anywhere. For example, the gut, all the organs in the body need blood flow. So the main job is basically the work of the heart is to eject blood and provide them sufficient quantity of blood so that the oxygenation is maintained. So when your heart is unable to do that, unable to pump enough blood to meet the requirement. For example, there is a requirement for the brain, requirement for the kidney, even for the heart has a requirement. So the if that comes down, if that requirement is not met, or the capacity of the heart to do that comes down, then we say there is a failure on the part of the heart to function properly. That is what we, for in a layman's terminology, one would say it's heart failure. So I'm not really going into the depths because I understand the audience are mostly the general public. So it is important to understand that your heart, in layman's terminology, your heart has become weak. So that is essentially what you mean by heart failure.
राइट सर। सो हमें डॉक्टर जय गोपाल बताना चाह रहे हैं कि हार्ट फेलियर मतलब हार्ट का फेल हो जाना। हार्ट का प्राइमरी फंक्शन होता है पंपिंग, यानी कि जो भी ब्लड हमारे अंदर होता है वो किडनी, ब्रेन, वाइटल ऑर्गन्स, लंग्स, जहाँ भी हमारा ब्लड जाता है नसों के ज़रिए हार्ट का फंक्शन होता है पंप के द्वारा अपनी पंपिंग एक्शन से उसे वहाँ पे पहुँचाना। तो ये पंपिंग एक्शन जब अफेक्ट होती है उसे हार्ट फेलियर कहा जाता है। और अब हम जानेंगे कि इसके कारण क्या होते हैं। What are the different risk factors and causes leading on to this kind of a condition where your heart, which is a very vital organ, has kind of failed and is unable to pump out your blood?
Yeah, so I think what one must understand, this is the just like somebody has a chest pain today. People immediately understand it's something to do with the heart. But when a patient's heart fails, it may be chest pain, but the most important symptom one would have is actually a shortness of breath. Not able to perform the activity, or let us say, if it's been there for a while, or say suddenly somebody is struck with a problem where he's breathless, he's not able to breathe. This often happens in the middle of the night, and I think that is one of the real serious issues when your heart suddenly fails. So this is something which you need to understand, and we know because we have done large scale studies across the country today, and we have the information that the major reason for this, as all of you are aware of, when you become aged, the heart tends to, there are multiple reasons, the heart is put into stress and load. For example, the common thing is a high blood pressure. In a country like India today, we know that one third of our population actually is prone for high blood pressure. But unfortunately, only about 6% are they go to a doctor with symptoms related to high blood pressure. So the number one factor would be reduction of flow to the what we call as a heart attack. When your the heart is supplied by three blood vessels, and that essentially takes care of the flow to the heart. So once that is affected, we call it as a heart attack. There is an insufficient flow of blood, and the heart, that particular area of the heart, is not able to pump well, and that is the 75% of our patients today have heart failure because of this. The second important thing is, as I had mentioned earlier, uncontrolled blood pressure. I mean, I think the layman today should understand that at least one third of them stand a chance. I mean, has a risk of developing high blood pressure, and it's important that this is recognized early. If that is not recognized, and this blood pressure is not controlled, the heart actually is unable to pump the blood against this high pressure, and the heart fails. Third, of course, we say so many things. Chronic kidney disease. We today in India, thanks to the modern treatment, people are surviving longer. The average life expectancy is better. At least in a state like Kerala, it's remarkably improved. So it's more like the Western countries. So when you age, just like your heart, the kidney also starts aging, and then you tend to have a kidney disease. And these are again very important factors to lead on to high blood pressure. I mean, heart failure. Similarly, diabetes, various risk factors, and sometimes today we had the headline cover story, description of COVID-19 producing a acute infection on the heart. So these are all very important things in the present day world. So that is again one rather relatively lesser cause, but again something which we need to understand. So essentially, there are many reasons, but the major risk factors would be high blood pressure, heart attack, or even diabetes and chronic kidney disease. So these are the few things that people should really be aware of and be concerned about. So we keep saying that you must know your numbers. What are the numbers? For example, the blood pressure reading, your sugar reading, and your cholesterol reading. All these things are very important. So you know your numbers, you can protect your heart. I think Dr. Vinny's connection is, yeah. Dr. Vinny, can you hear me? So, yeah, Dr. Vinny, I think we lost connectivity for a while.
Yeah,
And
I'm sorry, in between, yes, I might have lost everything. So, we were talking about heart failure causes and major risk factors, जिसमें डॉक्टर गोपाल ने हमें बताया कि जो मेजर रिस्क फैक्टर्स या फिर फैक्टर्स होते हैं हार्ट फेलियर के, उसमें डायबिटीज एक बहुत ही कॉमन कॉज है, जिसमें साइलेंट हार्ट अटैक्स होके एक हार्ट का हिस्सा शायद काम करना कम कर देता है, जिसकी वजह से ऑन अ लॉन्ग टर्म हार्ट फेलियर हो सकता है। और डॉक्टर जय गोपाल ने काफ़ी स्टडीज़ करी हैं अक्रॉस इंडिया, उनका इसके बारे में काफ़ी ज़्यादा रिसर्च है हार्ट फेलियर के बारे में। और 1/3 जो हमारी पॉपुलेशन है, वो हाइपरटेंशन से ग्रसित है। पेशेंट जब हमारे पास आते हैं और नॉर्मली हम उनका बीपी चेक करते हैं और पाते हैं कि उनका बीपी अनकंट्रोल्ड है और उन्हें कन्विंस करते हैं कि उन्हें ट्रीटमेंट की ज़रूरत है। कई बार पेशेंट ये कहते हैं कि नहीं, हमें ब्लड प्रेशर की गोली नहीं खानी है, लेकिन ऐसा ना करें। अभी मैं डॉक्टर जयगोपाल से ये भी पूछूँगी कि इसके लॉन्ग टर्म इफ़ेक्ट्स क्या है अगर हम अपने हाइपरटेंशन को नहीं ट्रीट करते। तो ऐसी कंडीशंस को ट्रीट करना लॉन्ग टर्म डिज़ीज़ेज़ को प्रिवेंट करने के लिए बहुत ही अनिवार्य है। उसके अलावा जो है हमारे हार्ट फेलियर के और भी कई कारण हो सकते हैं, जिसमें किडनी की डिज़ीज़ेज़ होना या फिर कोई भी क्रॉनिक कंडीशंस होना, यानी कि अगर क्रॉनिकली आपको हाइपॉक्सिया रह रहा है या आपकी ऑक्सीजन कंडीशन बॉडी की कम है किसी भी क्रॉनिक लंग डिजीज़ की वजह से, उसमें भी हार्ट के फेलियर बनना बहुत ही कॉमन होता है। रिस्क फैक्टर्स, कॉजेज़ कई हैं, लेकिन फेलियर जब सेट इन हो जाता है, तो उसमें हमें कई चीज़ें करने की ज़रूरत होती है। Dr. Jayagopal, we spoke about hypertension, which is very, very common in our country. And people who come to me, when I routinely check their blood pressure, I find it out of tune. I try to convince and tell them that you need treatment for hypertension. When I check their previous papers and I see that it has been high over a period of time, they tell me, yes, we are not on treatment, we don't get any headache, we don't have any problem, we are hale and hearty, and we would not like to go on to a medication for blood pressure because we will get used to it. So, how important is it to treat hypertension per se? And if we don't treat hypertension, what can it cause in future?
Yeah, that's indeed a very good question. I think the relevant major problem that we need to address. For example, I remember the article by 2014, if I remember, Kanchana et al.'s. Uh, the percentage of people who had, the I had earlier mentioned about 6% of the people are only symptomatic. 95% of them they are not aware, and it's just picked up on a routine checkup. So if you see the control of blood pressure, for example, the Western countries, it's fairly about more than 50% are well controlled, whereas here it's just about 10% of the people who are controlled. Now, why does this happen? It is basically because many people are asymptomatic, so they think taking a drug is unnecessary, which is not correct. Now, what you need to understand, for example, if you fall ill, for example, the major problem with high blood pressure, what does happen? What is a major impact on your health? If the blood pressure goes on at a very high level, one fine morning when you wake up, you have a devastating stroke. The one side of the body is paralyzed, and at that point of time, there is very little that you could do. Very little. You might spend even let's say lakhs of rupees, but then the chance that you have a near normal life after that is gone. So it's like I always tell them, it's like a traffic signal. There is a red light there. You're supposed to pause and stop there. The discipline has to be there. People say that I have crossed it so many times without a problem, but the moment you go there and somebody hits you and you're out, when you then there is an issue. It's almost like that waiting to happen. So that should not be the case. The most important, the devastating thing is stroke, number one. Today we know, we were talking earlier about diabetes, and you say that it's a silent killer, produces heart attack. Today the IT population is an ample proof. These guys are all stressed out. At the age of 30, 34 years, they have high blood pressure. They work 14 hours, 16 hours without adequate rest, and the BP shoots up. And what happens? They all develop heart attack at a very young age, and the quality of life is gone. And then over a period of time, they're not able to carry out their routine activity. So the second important thing is this heart attack. And the third major thing is the progression to kidney disease. Again, once your kidneys are affected, whatever drugs that you take, the outcome is not very good. So you tend to be on a larger list of drugs. You tend to have a poor quality of life, and finally end up with many diseases. So I think you are possibly deciding, your destiny is in your hands. So understand that high blood pressure leads on to the most devastating thing is a stroke, kidney disease, heart attack, and sometimes the vision is also lost. So what is the point living a life with loss of vision? So if you understand this, I think one would do every go forward take every step to see that the blood pressure is well under control. I think that's the need. The educating the public is what is required. And it's not that you're once you have high blood pressure, you have a problem there, and it has to be sorted out. So
Right.
that's
So
what I say.
this is a message for healthcare personnel as well, that if you find consistently high BP readings, don't leave it untreated. It's absolutely essential that you treat the hypertension early on to prevent further progression of diseases which can be heart, kidney, or stroke or cardiovascular problems, which can be increased mortality, or it could be in terms of morbidity. So हमने डॉक्टर जया गोपाल से जाना, आई एम सॉरी, डॉक्टर जय गोपाल हमें बता रहे हैं कि अगर हम अपना ब्लड प्रेशर अनट्रीटेड रखते हैं तो उसके इफ़ेक्ट्स काफ़ी डेवास्टेटिंग हो सकते हैं इन द फॉर्म ऑफ स्ट्रोक, आपकी एक साइड ऑफ बॉडी पैरालाइज़ हो सकती है। वहीं हार्ट अटैक की चिंता भी बढ़ जाती है क्योंकि इनके जो रिस्क फैक्टर्स होते हैं काफ़ी कॉमन होते हैं दोनों के बीच। हाइपरटेंशन, डायबिटीज़ या हार्ट के अटैक आना, ये सारी लाइफ़स्टाइल रिलेटेड डिज़ीज़ हैं और रिस्क फैक्टर्स क्योंकि कॉमन होते हैं, तो इन लोगों में हार्ट अटैक की रिस्क ज़्यादा होती है। ज़्यादा ब्लड प्रेशर बने रहने से किडनी पे भी असर आता है, जिसमें किडनी फेल हो सकती है और इसी तरीके से लाइफ़स्टाइल डिज़ीज़ेज़, मोटापा बढ़ जाना, सेंट्रल ओबेसिटी हो जाना, आपका ब्लड प्रेशर कंट्रोल ना होना, आपकी एडिक्वेट स्लीप ना होना, कई चीज़ों का कारण बनती है और यदि आपका वेट जो है वो बढ़ सकता है, तो आपकी नींद पे भी इफ़ेक्ट आता है, जो फर्दर आपकी जो हाइपरटेंशन है उसको वर्सन कर सकता है। तो काफ़ी सारे रिलेटेड चीज़ें हैं और इसको अनट्रीटेड बिल्कुल नहीं छोड़ना है। यदि आपको हाइपरटेंशन डिटेक्ट हुआ है, तो बेहतर है कि आप एक ट्रीटमेंट लेके गोली खाएँ, ना कि एक विज़न लॉस जो कि एक और इफ़ेक्ट होता है हाइपरटेंशन का, बिना विज़न के चलते रहें। एक बिना विज़न के आदमी बहुत ही डेवास्टेटिंग कंडीशन है एज़ कंपेयर्ड टू रोज़ की एक हाइपरटेंशन की गोली खाना। Dr. Jayagopalan, we have known about various causes of the heart failure now. Are there any risk factors which are there, which can be in terms of lifestyle, which we could catch very early and intervene in terms of giving an advice to our patients so that they don't get these kind of dreaded diseases?
Yeah, I think today the guidelines are very clear. You say a stage A where somebody does not have high heart failure, but they are all prone. For example, people with high blood pressure, diabetes, and again, same thing, chronic kidney disease and things like that. And then sometimes, for example, a family there where there is a genetic disease, the heart muscle gets thicker, and if that's a substrate, in other words, they have a chance. So if you are able to identify this at an early date, that's where essentially what I said, particularly above the age of 40 years, if you start looking at your figures, like if your sugars are high, if your blood pressure is high, your cholesterols are high, and if, for example, you also have a family history, these are things which you can possibly at an early stage find out and then use medicines. Because today we know, if you have high blood pressure, a class of drugs called the RAS inhibitors, if you put them on sufficiently early, you can prevent heart failure. Exactly like that, in a patient with diabetes, today the new kid in the block, the newer SGLT2 inhibitors can prevent heart failure. In fact, the best evidence for heart failure reduction is with this molecule. So there are a number of things that you at our command, but I think more important than that is probably uh, uh, people who are sedentary, obese. These are the group of people which is becoming more and more prevalent. In fact, in a state like Kerala, I can tell you that 35% of the population is obese. It's not a small amount. So what do? I think the important thing is to, if you start doing a regular exercise, and the moment you start doing regular exercise, that is beneficial, not in terms of reduction of your sugar, blood pressure, but also you tend to know where you stand. And at that point of time, if you develop any symptoms, for example, on walking, you start getting breathless, you have to stop in between. That's one of the earliest signs to visit your doctor, find out whether you have any heart related ailments, and that is perhaps the point where everything could be reversible. So I think that's very important. And exercise, good food habits, adequate sleep, and of course we can always say that avoid stress and tension, which is not easy, but it's just better easier said than done. So these are the few things that one should really be get into, more of relaxation and things like that, and then more on fresh fruits, vegetables, and all that, which help you to cut down your weight, and that will go a long way.
Right. And in terms of more of screen time, which has increased both for
Yes.
adults as well as for children, we have to go down on this screen time, give ourselves time with ourselves. That's really, really important. So it's so busy every day, you don't get time even to talk to yourself. It's really important that you talk to yourself and your body and understand your body needs. अपने ही needs को जानना बहुत ज़रूरी है. अपनी body के साथ communication बहुत ही अनिवार्य है। और यदि आप कोई ऐसी लाइफ़स्टाइल है आपकी, जो कि हेल्थ के लिए अच्छी नहीं है, जिसमें स्मोकिंग, सेडेंटरी बैठे रहना, बहुत ज़्यादा एक्सरसाइज़ का ना होना, अपनी डायबिटीज़ को अनकंट्रोल्ड रखना, हाइपरटेंशन को अनकंट्रोल्ड रखना, मेडिकल कंडीशंस को इग्नोर करना या अपनी दवाइयाँ टाइम पे ना लेना, ये सारे रिस्क फैक्टर्स हो सकते हैं, आपको पुश करते हैं टुवर्ड्स हार्ट फेलियर। Dr. Jay Gopal, we have all known about everything now. So, if somebody has heart failure, how to detect it? How is it important for a person who's staying with you to understand that their nears and dears might be having heart failure? And what are the investigations we carry in terms of knowing the heart failure?
Yeah, I think is a very pertinent question. The first thing that one must understand, today somebody has chest pain. In fact, even before even a doctor sees, at least in our practice, in this part of the country, people get an ECG done. Likewise, if you have the first symptoms of a breathlessness, we always say four in number, heart has four chambers. So you have breathlessness, chest pain, or giddiness, or even a palpitation. So these are all few things, pointers suggesting that your heart is not well. And the moment you have a breathlessness, the first thing to do is possibly an ECG. Why ECG? It's not only, unfolds a heart attack, but we have seen from our data and study in the country that 90% of the patients who come with acute heart failure have an abnormal EKG. So that's the importance of an ECG. And so if you have any symptoms, please go to your doctor. And then, if you're not feeling well and if you're breathless, the second step is to get a chest X-ray, which is again a very inexpensive and easy thing to do today. But of course, the confirmation basically comes by two important tests, which may not be available across the world, across the country. But then, an echocardiography in a specialist care, this is possible. But then the diagnosis is often clinical. Your GP or physician can often diagnose this, and a medication. For example, an injection there could be life saving for you. And so finally, the important thing, there are some blood tests also today which are available, which tells you clearly whether it's heart failure or not. We call it the NT-proBNP, which I think is very expensive, not widely used in the country. But then we can conclusively say that this patient has heart failure or not. So, but the basic thing will be to get an ECG, get your pulse, BP, your checkup with your doctor, and then go accordingly.
राइट सर। तो बहुत अनिवार्य है कि यदि आपको साँस फूलना या फिर चेस्ट में पेन रहना या कई ऐसे सिम्पटम्स हैं जो कि अनयूजुअल हैं, आप अपना काम-काज नहीं कर पा रहे हैं, बहुत ज़्यादा आपको प्रॉब्लम रह रही है, सर में दर्द रह रही है, साँस का फूलना हो रहा है, खाँसी आ रही है क्रॉनिकली, आप सो नहीं पा रहे हैं, स्पेशली लेटने पे आपकी ब्रेथलेसनेस बढ़ती है, तो अपने डॉक्टर से ज़रूर मिलें। वो बेसिक टेस्ट ज़रूर रन करेंगे और ये एंश्योर करेंगे कि आपका इको या फिर एंटी-प्रोबीएनपी जो हमारे न्यूअर टेस्ट हैं, जिससे जाना जा सकता है कि किसी व्यक्ति को हार्ट फेलियर है या नहीं है। हमारे साथ काफ़ी लोग जुड़े हुए हैं, मेनी पीपल आर कनेक्टेड टू अस राइट नाउ अलोंग विद देम आई विल टेक अ फ्यू नेम्स। संजीव पुरी, गुड इवनिंग ही इज़ सेइंग टू यू सर। मनु शर्मा, गुड इवनिंग टू यू आल्सो। विवेकानंद, संजय मराठे, एम हसन जी, they are all saying good evening. Ravi Ranjan, somebody has logged in by the name of Humanity. I don't know their name, but they have a question, sir. They are asking, it is regarding the impaired myocardial relaxation, which is a serious condition. My mother is diagnosed with it. Kindly suggest which beta blocker would be best for her. Currently, she is taking metoprolol and lisinopril.
Yeah, so this is the impaired relaxation is often because of high blood pressure, and again part of aging also. So, basically today when we as a cardiologist we would like to know whether the heart function is normal or abnormal. In other words, the function. If it's an impaired relaxation, that means it's actually a filling abnormality. There, beta blockers may not have a big role, but then whatever beta blockers that you have been using, metoprolol is good enough for control of heart rate. And the other drug which is on lisinopril ACE inhibitors, there is something which is more modern than that, which is called the neprosel inhibitor. which is perhaps a little more effective in this. Like there are no conclusive data, but then at least in a given set of patients based on their medical reports and the background blood tests, this is found to be useful. But then impaired relaxation, I think this is a condition today we categorize it as a preserved ejection fraction, heart failure with a preserved ejection fraction, which means the ejection fraction of the pumping capacity is normal between 50 to 70 or whatever, but then there is a relaxation abnormality, and the new drug, which is often, which is probably the game changer today, is an SGLT inhibitor. So, whatever drugs your doctor knows your mother's problem better, I think you stick on to them and then do follow. There are very appropriate drugs and which needs to be continued. The important message is do not discontinue these medicines.
Right. Sanjeev Puri ji has a question. He says aspirin, clopidogrel are blood thinners before surgeries. How to stop and start them after various common surgeries? So we need your expert opinion regarding the stoppage of aspirin and clopidogrel, which people are taking mostly for their heart diseases. They've undergone PTCA in the past, which we often encounter during our procedures. Also, if we have to do a bronchoscopy and an endobronchial ultrasound guided FNAC, we have to stop these medications. So how this should be guided, when to stop and when to restart?
Yeah. So I think the first important question is, why are they taking this medicine? For example, the indication, as was mentioned by Dr. Vinay, is mostly somebody who has gone through an angioplasty. So for an angioplasty, the doctor would prescribe this the two antiplatelets at least for a year's time. So it's unsafe to stop them before 1 year. The data suggests that these people should be on this, and at the end of that, could be on a single antiplatelet agent. So the first and important thing from your doctor is to understand whether it's safe to stop these medicines at all. For example, somebody must have done generally you use one or two stents, but sometimes for a main vessel also you do an intervention. So it all depends on the heart function. So in a given patient's scenario, it's important to understand how safe or unsafe is a stoppage. But all the same, if you have to go through a procedure, and if your doctor feels that this can be stopped, all these drugs should be stopped at least 5 days prior to the procedure. If it's a low risk procedure, for example, a dental extraction or a cataract surgery today, you need not stop that. You can continue that, because the new modern techniques would not lead on to any kind of a bleeding. For example, if you have a dental this thing also, it could have a suture and things like that. But then for an invasive procedure, you might have to stop these agents. But then the moment the procedure is over and the blood hemostasis is achieved, you can safely start it after 24 hours.
Thank you.
So it's no big problem, but I understand why this medicine has been started in the first instance. Always take your treating doctor's consent before you do that.
Right. Manish Saini has a question. It's a very pertinent question. Somebody has a heart attack. Now, we have seen that people who complain of chest pain often have symptoms which are similar to gastritis. So, how to differentiate between gas pain and heart attack?
Yeah, so I think the common things where something in the substernal region, the center of the chest, just got a radiation. Often, so the common thing, a very simple thing which you always tell our patient, if you are feeling uncomfortable lying down with this problem, it's more often a cardiac problem. And again, somebody feels like going to the toilet and things like profuse sweating. Please don't disregard these symptoms. And if it lasts for more than 20 minutes, for sure, I think this will be even a sinister issue. But I think the more important thing is, when you have this thing, please don't waste time trying to locate your doctor, trying to go to the nearest hospital which has got a facility for an ECG and even an ICU, because the first few hours are very important. So go there, get an ECG done at the earliest. Just look at your vitals. For example, the pressure, blood pressure, pulse rate. Today, after the COVID, many houses have a pulse oximeter, and so it's easy to understand your pulse rate. And also, if you find it's too low or too high, again, it's a red flag. Likewise, your oxygen levels are low, it's a red flag. So immediately rush to a hospital where you have this facility, and mostly the diagnosis is made by an ECG. But there are occasions where it may not be. For example, somebody has pain in the upper abdomen. That's often confused with the gas, and we all know that the right coronary artery, when it's affected, can produce a similar problem. But then the issue is that it is always safer to rule out a cardiac problem than taking it for granted that this is a dyspeptic symptom. So I think the important message is go get an ECG done, and if the ECG is not is inconclusive or not conclusive, then get a marker which is called a troponin, high sensitivity troponin. You have to have a value which, there's no point getting this thing which is negative or positive. The card tests are not reliable. When get a quantitative report, and if that is fairly within the normal range, that's a rapid rule out of a heart attack.
So in this regard, Mr. Sanjeev Puri also has a question. He asks indications to do TROP-T, TROP-I, and NT-proBNP. So what is the difference between the three?
Yeah, so the troponin and trop-I both are the same. These are high sensitivity agent. There is a little bit of a damage onto your myocardial cells. We call it necrosis. These are released into the circulation. Then it can start as early as 1 hour. So all the world associations, the European Society or the American, they all rely on the fact that if you want a rapid rollout test, you go to the emergency, get this troponin. If the troponin is less than the value, for example, TROP-T high sensitivity 4th generation would be 0.0014. So if it is less than that, we tell them that they are in the low risk category. We need not get admitted. But confirmation needs one more report, maybe 2-3 hours or 6 hours later. But it's always in the context of the story, context of the, you also take the ECG. But this is a very important. TROP-T and TROP-I are essentially the same, except that TROP-I was favored when you have a chronic kidney disease in an aged population where the false positives are less. Troponin T can be slightly elevated in some other conditions as well. But then these are, either one of the two you can rely on. But NT-proBNP is a marker for heart failure. It is not a marker for a heart attack. It's a marker for if your heart function is low and the wall stress or the left atrial pressures are high. So that actually tells you that you have heart failure. And again, these are the NT-proBNP is more often used in the setting of a hospital admission, or somebody has a breathlessness. You want to differentiate whether it's related to the heart failure or whether it's a respiratory cause. That is where the NT-proBNP would come in. But otherwise, these are all excellent tests with very good high sensitivity and fairly good specificity as well.
You very well told that if somebody has a heart attack, they should at once rush to the hospital to get an ECG at least. So why do we say that time is muscle? Why is it important for us to understand that we have to at once go to a center which has all the facilities available?
Yeah, I think it's important to understand how the evolution of heart failure treatment came into the world. For example, I still remember the vivid pictures of the Saigon, which is called Ho Chi Minh City. The first ICUs, in fact, these were all graphic pictures which are all available in early 60s. Prior to the 60s, out of 100 patients, 50 patients used to die. And most of the deaths used to occur in the first 1 hour. And when they had this is actually along with the army, they started this ICU setup and they started looking at monitoring those patients with chest pain. And what they found was most of the deaths were because of an erratic heart rate. The heart suddenly becomes very fast, what they call a ventricular fibrillation. And this often occurs in the first 1 hour. So when they brought in this concept of an ICU care and had a defibrillator give a shock, the mortality came down by half, 52. And when we were medical school students, that was the time, for the first time in the world, the reason for the heart attack became clear. It was appearing because of a blood clot. And you use a medication, which is streptokinase, you use it to dissolve a clot. This turned out to be very effective. I remember the days when we were doing MBBS, heart attack patients used to be in one corner for 6 weeks, and half of them used to die in the hospital. But then when this molecule came in, it was so effective that the death rates came down to 10%. So I'm talking about 50, half of that, and then 10%. Then the newer agents came. Today, we don't even use these molecules. In fact, 99% of our patients immediately are taken to the cath lab. And if you're able to open up the vessel in the first 1 hour, their heart function is almost normal. And today, the accepted mortality or the death rate is only 2 to 4%. And the longevity, it all depends on how much of your muscle mass is affected. If you wait longer, more amount of muscle is damaged. So if somebody comes within 1 hour, he has a near normal heart, up to 3 hours, it's okay. Beyond 6 hours, damage is gone, damage is done. So, imagine somebody coming after 24 hours. You might open up the artery, but the heart function goes down. So that's why you call time, you said time is muscle. So you need to act immediately, go to the hospital, don't waste time fooling around and then getting an ECG from one place, going and seeing a doctor in another place. Go to a place where they have the facilities, and please listen to your doctor there.
सो डॉक्टर साहब हमें बताना चाह रहे हैं कि क्यों अनिवार्य है कि यदि हम एक नियरेस्ट हॉस्पिटल में जाते हैं, तो बिना टाइम वेस्ट करे हमें मसल को बचाना है। जो हार्ट होता है, वो मेनली मसल से बना होता है और वही पंपिंग एक्शन से हमारे हार्ट के ज़रिए ही हमारे सारे ऑर्गन्स को जो है खून मिलता है। यदि ये पंपिंग एक्शन अफ़ेक्ट होती है, जो कि मसल के मरने के कारण होता है, नेक्रोसिस के कारण होता है, तो ये काफ़ी जल्दी मर जाती है। 1 घंटे के अंदर इतना नेक्रोसिस सेट इन हो सकता है कि ये मसल कभी जीवित नहीं हो सकती। लेकिन यदि उस 1 घंटे में इस मसल को दोबारा खून का जो है जो बहाव मिल जाता है, तो ये फिर से ज़िंदा हो उठती है। तो इसीलिए हम कहते हैं टाइम इज़ मसल, यानी कि टाइम बहुत अनिवार्य है इस मसल को बचाने में। तो अपना टाइम वेस्ट ना करें। आजकल काफ़ी अच्छे ट्रीटमेंट्स आ चुके हैं, जिनके बारे में हम डॉक्टर साहब से और बात करेंगे। लेट्स टॉक अबाउट द वेरियस ट्रीटमेंट्स commonly which are used in case of heart failure patients. So if somebody has got a label of heart failure, what are the common medications they have to be on?
Yeah, the first thing is always, you have to make a patient better. And the first drug that you would use in heart failure is a drug to increase the urine output, which is what you call a diuretics, something called Lasix or torsemide. These are the drugs commonly used. But today we know the four class of drugs which are actually effective for heart failure. One is a beta blocker, the other one is an ACE or an ARB, third will be a mineral receptor antagonist. These are all agents. The fourth one is the new anti-diabetic drug, which actually has found its place as an anti-heart failure medication. So these four drugs are important. Why we say about these four drugs is that if you don't prescribe these patients these four drugs, today you must understand that somebody who gets admitted with a heart failure, 10% of them die. That is the Indian figure which I'm quoting right now across the country. First admission itself, 10% of them die. And when you follow up these patients over a period of 1 year, 20% of them die. And within 5 years, at least a good percentage of them are either dead or having a poor quality of life and morbidity. So the important message is that heart failure is worse than cancer. For example, breast cancer you treat, prostate cancer you treat, they all survive for more than 5 years. Whereas once diagnosed with heart failure, acute heart failure, 30% of them, close to 20 to 30% of them, they die within the first 1 year. So why does this happen? It's basically because these patients are not put on the drugs. We have had studies where patients are on these eight class of drugs compared with patients having no drugs. And those patients who are on this guideline directed medical therapy, they all do very well in the long run. One drug is better, four drugs is better than three is better than two is better than one. So I think the important message is people should be on this appropriate medications from right from the beginning itself, and that is the way to treat it. Again, also you have to find out why this has happened. For example, if you have a block, that block has to be cleared. If you have a problem with the valve has surgery has to be done. Don't hesitate. If you try to hesitate and they think that it's going to be expensive, long term it's going to be even more expensive on medical therapy. So try to cure it once and for all, and then go ahead beyond this medication. But the major challenge what we see in our country, in fact, we have done a lot of quality control programs in India, even in our state, is making these patients stick on to this medication. Again, the fear that start on medicines, this is lifelong and it will ruin their kidney, or it is not going to happen. This is only going to protect their kidney, their brain, and the heart. So I think the important message is to see that the patients are on adherent to the medications, and that is the biggest challenge that our country is facing. Maybe the cost, but then in a state like Kerala, most of the things are looked after by the government, even for the poor. Second important thing is that the inertia on the part of the physician to give the proper dosage. The third thing is, of course, the patient's reluctance to take, and finally the reluctance to come for a follow-up visit. So we have done some intervention programs in this. For example, we have made use of these nurses in the hospital who would engage with these people, have a checklist, make sure through a phone call whether they're on sticking onto the medication, whether there is a weight gain. That's one of the earliest signs of deterioration. And then facilitate the follow-up either through the GP, physicians, or the cardiologist. And we have actually translated this into quality improvement programs, and we are actually pursuing this in a much bigger way in the country. A lot of new innovations are taking place today with the digital technology. You can also contact your doctor, find out about the medication. So at least for that class of people, it can be easily done. So there are many ways, but the important message is whatever your doctors prescribed, please stick on to these medicines and don't stop that without a valid reason.
सो मैसेज जो हमें डॉक्टर जयगोपाल दे रहे हैं कि अगर आपकी हार्ट फेलियर की मेडिसिन शुरू हो चुकी है, जिसमें कि एक डाययूरेटिक, एक बीटा ब्लॉकर, एक एआरबी या फिर नए डायबिटीज़ के मेडिसिन्स हैं जो कि प्रिस्क्राइब किए गए हैं, उन्हें अपने आप ना रोकें, उन्हें लगातार लेते रहें ताकि उनका फ़ायदा आपको मोर्टेलिटी और मॉर्बिडिटी दोनों के रूप में मिलता रहे। सर ने हमारे काफ़ी क्वेश्चंस जो है वो ऑलरेडी आंसर कर दिए हैं। डॉक्टर काम्या शारदा डॉक्टर एनएनएस शारदा इज़ connected to us right now. He is sending his regards across to you, sir. And he says important suggestions to the family physician who are taking care of these patients quite early in the community.
Yeah, I think that's a big. I mean, the link that you need to really I mean, encourage. I always feel that this is a huge challenge. A country like India, some of the interior places are not connected, and I think the general practitioner, the primary healthcare worker, has got a very important role. But then the first step is for us to educate them, make them understand how this could be easily diagnosed. It's no big deal. I think it's not rocket science. These are all small, simple things, simple algorithms. In fact, as an initiative from our organization, the Indian College, I have formalized a checklist and the algorithms for the GPs, the physicians, which will be circulated in a fairly shorter period of time. I think all of you will receive a copy of that. So these are simple things that you lead into the check. I mean, you need to look at the vitals, see the symptoms, and then see whether they get an ECG or X-ray done. You have to interact with your doctor and things like that, and then have a checklist on the medications. Understand what these medicines are, put them on that, encourage them, and again, you are the people who will probably have more time to spend you will probably have more. Let me say the rapport with the patients than the consultant. So these are important things, and make use of that. And I think once a patient understands that you're doing this for their benefit, and if they're very clear as to what the outcome would be, and what in terms of their healthy living, or let's say the long-term benefits would be, the goal would be easily achieved. So I think there are a lot of things that could be done at the primary care level. Just basically, I think improve your clinical skills. Simple blood tests, weight, looking at the weight and the fluid work overload and things like that can really help you in a much bigger way.
Right, sir. And use of stethoscope, which has actually gone very down with everybody, including senior persons, the junior medical staff. So we have to keep our stethoscope at the back of the chest and look for crepitations, which are very, very common with these people, which you can follow up also. Last but not, yes, sir.
Perfectly agree. Yes.
Last but not the least one, sir, everybody wants to know, is there a particular diet which should be followed up by heart failure patients, or anything which can prevent it in the long run?
Yeah, I think once you're diagnosed with heart failure, I think the important status is the fluid status. You can't be drinking 4 liters or 6 liters of and then you use drugs to flush out the urine. So that cannot be done. I think the most important balance is the fluid intake, looking at your weight, and of course the salt part of it. At least the southern part of the country, people are very, very fond of this salty pickles and So
not
I think
only
these
southern parts, sir. This is quite across the country. Yes, yes.
The country. I mean, anything which is tastier is always salty, but then I think you need to be really concerned about that.
Exactly.
And of course, if you're diabetic, you look at your sugar intake, and also the fatty food. I mean, red meat is to be avoided at any cost. And I think a vegetarian diet with lot of fresh fruits, vegetables will definitely. I think that is healthy for anybody. So these are few things which I would give as a practical tip. The habits change across. I mean, India is a country with so many states, so many different culture, and the food habits and all that. So it's essentially difficult to put it across the country. But I think these are the few things that you could generally avoid and be careful about the heart failure. But a very important thing is the fluid intake.
Right, sir. So anything regarding nuts which are important, or they should be taken?
Yeah, it's high protein. Actually, there's nothing really to be wrong with that. So unless you have some major problems in terms of your kidney disease, where sometimes you may have to restrict, but otherwise it's fairly all right. I think the dal and the that's the protein content which even egg is safe today. So I think these are few things which you can possibly take. You need adequate
Right,
protein. In fact, Indian diet is more of starch, so
right.
this actually gets converted into all your triglycerides and the various fractions. So I think cut down on the carbs, go a little high on the other stuff. That's the way to go about it.
सो जो आपने हार्ट फेलियर में कम करना है, एक तो पानी बहुत ज़्यादा नहीं पीना, अपने कार्बोहाइड्रेट कंटेंट को बहुत ही लिमिट करना है और वहीं अपने सॉल्ट या नमक को बहुत कम करना है। एनईजेएम में रिसेंटली स्टडी आई थी जिसमें ये बताया गया था कि अगर नमक का कंटेंट आप कम करते हैं तो ना ही कार्डियोवास्कुलर डिजीज़ेज़ बल्कि बहुत सारी ऐसी डिजीज़ेज़ हैं जिन्हें कम किया जा सकता है। वेस्टर्न सोसाइटी में नमक लोग कम खाते हैं, लेकिन हमारी कंट्री में नमक बहुत ज़्यादा खाते हैं। हर चीज़ में चाट, चटोरे और नमक डालना हमारा काम है, लेकिन ये बहुत ज़्यादा आपको अवॉइड करना है। We have discussed many things today and you increased our knowledge many-fold, sir. So thank you to you for sparing this time with us, this valuable time with us, and your valuable suggestions to us because you have done so much research in heart failure. You're following up patients and doing so much of good work. We express our gratitude to you. And the last thing which we would like to know is really, really important because a new diabetes drug has come up, which has actually mortality benefits and quite a lot of benefits in terms of heart failure patients. So, something regarding this, and in particular for our medical community. Who are the ideal candidates for this? When this should be started? Can this be started straight away? And what should be monitored in this newer kind of medication?
Yeah, I think thanks for the question. It's a trend now. I think we cardiologists say that we are stolen away this molecule from the endocrinologist. So it came as an anti-diabetic drug, but this is now used by cardiologists left, right, and center. So the overwhelming evidence is in heart failure. There's no doubt. That's probably the first. Somebody has heart failure today. We don't even have to know whether it's a reduced ejection fraction, whether it's a preserved ejection fraction, both category, and there's only drug for preserved ejection fraction. So there you can straight away start on this either. Yeah, the data came with EMPA, but now you have it with DAPA as well. So both are absolutely good. And the more important fact is that nephrologists have slowly started embracing this because it's protective even for the kidneys. So I think the rate of decline of the GFR is also there. So that is the this thing. Of course, the moment you have a cardiovascular, we have seen right from the as a primary prevention drug. For example, those patients with the cardiovascular risk factors, it's found to be the initial drug emparagam outcome and all that. All these have shown that it's got benefits across every spectrum of disease. So I think, except for the cost compared to metformin even today is a cheaper drug. It stood the test of time for the last 5 decades. So I would feel that if somebody has evidence of heart failure, this will be my first drug. If somebody has any other cardiovascular this thing, I would always add this drug along with the metformin if it's possible. The benefits are very, 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 very good. So when do you start this? Well, in a heart failure, we thought it was only in stable heart failure, but we have also done a lot of studies now work on even in acute heart failure. It's found to be fairly effective. And initially, we were all worried because the sugar goes through the urine, so urinary infection, sepsis part of it. So these are few things which we are worried about in the initial stages, but right now we don't get to see that much. But then never used this in a acutely sick,
Right.
critically ill, sick, septic patient. There you need to avoid that. And of course, somebody has a recurrent urinary infection, and the problems encountered because of that. I think it's preferable to avoid that. Otherwise, I think today this is a drug which is fairly well accepted and it's become cheaper now. So you could use it in any spectrum of cardiovascular disease. So I think it's a fairly safe drug.
Right, sir. Many, many thanks to you for gracing us today and sharing your knowledge, your immense knowledge with us regarding heart failure. We have our gratitude for you and thank you for coming to us on
Thank
this
you.
show
Thank
and
you.
discussing this with us.
Thank you.
We
Really
have a Thank you, sir. We have a very small gesture of appreciation for you. We have this certificate which we are going to show in the show, sir. This is just a very small feather in your already decorated cap. So, thank you for joining us today. Now
so
we
much.
will sign off because the time is running off and we need to rush. And Dr. Jayagopal is a very busy person, so he also needs to rush out. Thank you for joining us today on
Thank
Dr.
you.
KK's Med Talks.
Thank
We
you.
will
Thank you.
we will meet you again tomorrow with a very interesting topic. So we sign off for today. Jai Hind.
Jay, thank you.